Hello and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today we're going to talk with a doctor and a patient from the Hampton University Proton Therapy Institute. Welcome, Dr. Tyvin Rich and James Burton. How are you?
Fine.
And so we can clarify which is which. James, you were the patient and
Yes.
you've been there twice.
Twice.
That is a real success story.
Yes, it is.
And you're doing well. Let's let people know right off the bat.
I am doing great.
You look great.
I feel great.
You look wonderful. And Doctor, how long have you been there?
I was there since the beginning, 2010. We've been open almost to the month for 5 years.
Wow.
Now, over those 5 years, it's ramped up to the point where we're treating about 50 patients a day. When we first started, it was slow, but we're full running right now.
And you know, okay, when I think of the Proton Therapy Institute, I will say I think of prostate cancer. And when you guys opened, that was sort of your specialty. That was one of the main impetus. But at the time, you knew it had other applications.
No question, prostate cancer was and has been the main thrust. We've treated now over 1,000 patients. I think our 1,000th patient was sometime earlier, 2015. And I would say the majority of those have been men with prostate cancer from the Middle Atlantic region.
And in fact, that's how James first came to you, right?
3 years ago.
I mean, only 5 years old is actually, it's a long time, but it's also still new in terms of treatment facility. So how do people come to you? How do they know about it? How do they know they're a candidate for proton therapy?
Well, maybe I'll let Mr. Burton explain how he came.
Well, my doctor, I was diagnosed with prostate cancer. So my doctor gave me 5 options.
Okay, 5, that's a lot.
Yes. One was surgery, one was radiation seeds, one was proton, and I really can't recall the other 2 now.
Was it chemo or something like that, maybe? Or
Yeah, maybe.
okay, so none of them sounded great.
You know, the only one that really sounded great to me, well, it was 2, the radiation seeds and the proton. But the doctor told me with my urinary problem, I wasn't a good candidate for the seeds.
I have heard a lot of people doing that. Okay.
So my other option was the proton center.
Well, now, and science is going to be way over my head, so dumb it down for people like me, but how does proton therapy work?
Well, proton treatment is a form of radiation therapy. And we do the treatment with a proton beam rather than an X-ray beam.
Okay.
So, differences. The proton is a particle, and particles interact with matter in our bodies in a different way than with an X-ray. And think of it as an X-ray will go into your body and just keeps on going right through.
All right.
A proton is different. It is a particle that goes into the body and then goes to a specific depth or distance into the body and then gives off all of its effect.
Right there.
And stops.
Okay.
Some people have described it as more like a bottle rocket that goes up and it pops and then it's over.
Where it's supposed to go.
Where it's
right.
supposed to go,
okay.
exactly. So that means...
Now see, that I can understand. That's a good explanation for the layperson.
Yeah, and what that means is that the tissue behind the area that we want to treat is spared radiation, no radiation. Now, this is a fact. There's no making this up. This is a physical fact. The controversy, if there's any with the protons, is that it's of limited resource because there's only about 15 facilities across the country, and it's somewhat expensive today. Those prices, I think, will come down.
Right.
But those are some of the issues that we face. So because of those physical features, protons worldwide have been accepted for certain sites around the eye, near the brain, where the beam can go in, kill the cancer, and not kill the brain.
Wow.
That's where we first have used this, and that's accepted. So tumors along the nervous tissue from the brain down. And in children, where if one wants to treat a child, if you can avoid any unnecessary irradiation to a growing tissues, to those growing tissues, that's a big advantage.
Well, and there's a kind of a lifetime maximum of radiation a lot of times too.
And
you don't want to blast these kids when they're little, and then what happens
Anytime
later?
you can avoid that radiation, and you can do it with protons. So those are the accepted areas. So for many years, when we had just a limited number of beams in Boston, out in California, those were the only two facilities, basically. There were just a limited number of patients that we could treat. Now
and it was on a priority kind of basis.
Exactly. But now we have more machines, more facilities, and we are starting to ask the questions where this kind of treatment might be useful for other common cancers.
Okay.
Prostate.
So James' second occurrence might be an example of that.
Exactly.
Because it was in his chest, not one that you necessarily have treated a lot of, although you're doing more chest and lung.
The group in California that has had a proton beam for now over 20 years have published very nice data on the use of proton radioablation, I call it, of small lung cancers that are out that we can pick up early. And we know that in certain people who cannot tolerate an operation because of their medical condition, we can go in, target it, and eliminate the cancer. And they have now 10-year data showing that we're actually able to cure these small peripheral lung cancers. Now we can do that with X-rays as well. That's something that's also been published. But the interesting thing about the protons is that the side effects are very, very low. They're lower than the X-ray treatment. That's published. Some would say, well, we need to study that and confirm that. And those are the kinds of things that we're doing now with these 15 institutions across the country. People are getting together and doing collaborative studies to try to answer more questions about where the proton treatment is useful.
Where it's best for the patient, best results for getting rid of the cancer.
Exactly.
So James, how did you come back? How did you get diagnosed with the cancer in your chest, and what did your doctor say at that point?
Well, I had surgery for the thyroid.
Okay.
But the doctors that operated on me said it was like in a margin. And that means he couldn't go in there and get it. It was too close to the heart.
So he got some of it, but not all of it? Or he got in there and just said, oh, can't do it?
Yeah, he got part of it, and that's why I had to go to the Proton Center.
So you had a small piece of tumor left?
Yes.
And as I understand it, your insurance covered it.
Yes, it did.
Which is phenomenal, because not every company has accepted, or at least not in every instance.
Correct.
We still have to fight that battle. What can we do? Because you've got a lot of examples walking around in Hampton Roads and in other parts, especially you guys on the East Coast, of really successful treatments that have been less harsh on your body than some other treatments might have been.
What we could do is, like any new technology that comes along that is expensive, we need to study it and test it and accrue data where we answer these questions. How much better? Mm-hmm. Is it better just on the treatment side or on the side effects side? Or both?
And what's that trade-off, right?
Or
cost
both.
Effectiveness.
And one of the other things that we can certainly do is conduct trials where we ask these questions. Mm-hmm. And according to the new healthcare law of the land, of the Affordable Care Act, the wording is that if we have trials, that the patient cannot be denied participation by the insurance company. So there's some fiddling around that goes on with the language and the negotiation with the payers, but I think we are structured to try to understand where its role is and do it in a scientific way so that we will answer the questions and and know its true value.
Right.
Those,
right.
That's an issue that's incumbent on us to answer, and we're doing that.
And to work with, what I like too is it's not each center out there for themselves. You guys are collaborating, you're sharing data, you're looking for, where that proven effectiveness level is.
That's correct. We have a structure called the Proton Collaborative Group, and right now I think we have 4 or 5 protocols for various cancers, not only prostate cancer, but for lung cancer as well.
So, how was this when you got hit the second time with cancer? Did you just, that bites. How did you react? What did you do?
My first one came out so good. And I said, well, I have to go back to the Proton Center. It worked the first time, it should work again.
So in a lot of ways, you have a different view of cancer than somebody else who had maybe a much more difficult time, a much more invasive procedure, the whole I'm a survivor, the whole battle. Your battle was maybe a little easier.
It was easier. It was a lot easier for me.
So when it hit the second time, it was more like, now I know what to do?
Exactly.
Wow. Wow, that's...
Exactly.
I've spent a lot of time at Relay for Life and with cancer patients and cancer survivors, and your story is unusual.
I've talked to a lot of friends that had prostate cancer. This option wasn't available to them.
Right.
Years ago. And I told them about it, and they said they wish they had the opportunity for the Proton Center.
Well, and we're so lucky that it's here in our locality.
Yes.
A lot of people, I'm sure, travel for treatment. And we don't have to travel.
I met a lot of people from other areas when I was going through my treatment that was coming up and had to stay a week or so, whatever. But they had to travel. But it made it so easy being here locally.
Mm-hmm. That's a phenomenal resource.
Yes.
Well, let me ask you, for the folks out there who don't have cancer, there are some things we can do to reduce our risk, particularly the lung cancers, some of the other things. Tyvin, let's go through. You can't eliminate your risk, but you can reduce it, at least from some cancers. What can we all do to help prevent that?
Well, we understand that there are environmental exposures to nasty things, the content of cigarette smoke. We know for a long time now contains things that are not good for you.
Right.
Creating a chronic inflammation that is a setup for cancer.
So don't smoke. Don't be around secondhand smoke
if you can avoid it. That's correct.
Yeah.
So we know that, but it's a social phenomena. So it's easier said than done. I realize that. I'm on the downstream of the whole process, if you will. I'm not in preventive medicine. I'm not in social, therapy, that sort of thing. But we know that. Avoiding certain kinds of infections with certain viruses, we know that they are a precursor to various cancers of the stomach, of the liver, of the uterine cervix. So there are a number of cancers that are clearly related to viral exposure. And that also can be avoided through public health and wise behavior. So we do understand more and more about some of these associations. The actual cause and what's the actual molecular mechanism, well, we'll be studying that for decades.
That part, right.
And that's important to do. And we're always making strides of understanding some of those mechanisms to come up with new interventions. That's a whole nother part of medicine.
Well, then my other question is going to be, if we're out there, we're diagnosed with some form of cancer, and of the options our doctor gives us, proton therapy is not one of those. We can ask, right? We have that right as a patient to say, would this work? Would my insurance pay for it? What can I do to have a good outcome and minimal side effects?
I would say I can't disagree with that statement. I would only enjoin the caveat that if the word radiation treatment is mentioned in that discussion of how I want to treat your cancer,
Okay.
then it makes sense to ask the question,
What
would there
about-
be some role for protons?
Okay.
Because cancer has many, many different kinds of
Right.
diseases and stages.
And they don't the same treatment doesn't work on everything.
Correct. So,
Okay.
but
But that's a key thing then if your doctor mentions radiation to say, what about protons?
especially in that situation.
Okay.
And I would say we're always open to a phone call, and we have a staff that will walk people through. And there are times when the situation may not be appropriate if it's a widespread cancer, but there are always issues that come up. So I would say we are a resource that should be considered. Yes.
Okay. Thank you. Thank you very much. I appreciate it. And congratulations to you. You look wonderful. I'm so glad for 2 positive outcomes.
Thank you.
Thank you for watching, and I hope you've learned a little bit more about this resource. Hope you don't get cancer and don't need it, but if it is appropriate, they're there. Call them, look into the options. Thanks for watching.